Hello! This video will help orient you to the contents of your wellness care kit that was developed to help you promote infant and early childhood mental health for your patients. Your role in the life of children and families is so very important. Young children have at least 10 wellness visits in their first 5 years of their lives. These visits are wonderful opportunities for you to not only address physical health, but relational health as well. Early intervention for mental health concerns requires less time and energy than later interventions, and it results in symptom reduction and causes measurable changes in brain development. We hope to support you as you provide guidance and support in the health of the families you serve. Thank you for taking the time to watch this video. We are the Early Childhood Mental Health team at the Greene County Educational Service Center. We are here to help support the social and emotional skills of the children across Greene County. First, I'll share with you some of the information on the 6 ways to build a better brain infographic. This is targeted for early childhood, children ages 0 to 8. When a parent or caregiver comes to you and talks about problems they have with their child's social and emotional skills, this resource will be very helpful to them. Parents look to you for guidance and consider you to be experts in child development. What you share with them can make a big difference on how they develop relational health with their child. When they come to you with behavioral problems such as, my baby cries all the time, or my kid never stops asking for technology, or my toddler won't stop hitting me, you can share some of the tips from this infographic with them. Reflect and connect is something that you may suggest to a caregiver who doesn't seem to be attuned to their child. This adult may need to practice stepping back and thinking more about how their child is feeling. For example, a caregiver who talks about a child who whines frequently may benefit from you pointing out the importance of checking in with your child and then taking the time to connect by doing an activity together, such as planning, making, and eating meals together. Caregivers who may come to you with a complaint about their child's outbursts may need to practice recognizing emotions. By acknowledging our child's emotions and practicing being calm ourselves, we can teach children how to regulate themselves. We hear the buzzword co-regulating quite a bit now, but we know from brain science that co-regulation truly happens in relationships between the adult and the child due to mirror neurons in the brain. Remember, a calm adult equals a calm child. Ritualizing routines is important because we are all less stressed when we know what to expect. Children thrive on routines and predictability. In your office, a caregiver might say something such as, they had a hard time getting their kids to put their shoes on and get into the car to get here, which we know means that they might have a hard time with transitions. You may want to share that they can give their children reminders before moving on, or to model what they want their children to do. You can suggest that next time they say, let's get our shoes on together, and then the adult sits with the child to put their shoes on as a team. You may have heard the quote, play is the work of the child. This is why it's so important to read, sing, and play together. In your office, you may walk in and see that your patient is on some type of device. Screens can be a helpful distraction, especially in medical settings when a child is not feeling well or is in pain. Our goal is to see caregivers spend more time reading, playing, singing, having face-to-face serve and return interactions as opposed to more interactions with the screen. We can emphasize the importance of making time for this in their day-to-day lives. We usually get more of what we pay attention to. When we were working on our college degrees, when we studied, we got a better grade. When we didn't, we would not do as well. When parents focus on negative behaviors, they will get more negative behaviors. When they focus on positive behaviors, they will typically get more positive behavior. You can also encourage them to replace no with more of what they want to see. When caregivers say their children are always asking for snacks, you can suggest they let the child know mealtime will be soon and then offer 2 choices for the child, such as, would you rather read a book with me or play outside? Remember, keep it positive. Kids need lots of love and affection. Respond in real time means that we need to be attuned to our children's needs. When a child is not getting their needs or requests met, they will get louder or try other methods until they feel heard. It's easy to get distracted as a caregiver, but we want to try to be fully in the moment. Before caregivers respond to a challenging behavior, they can take a deep breath, Not just in, because then it's easier to ramp up to let anger out, but in and out to make sure there is enough oxygen in the brain to respond appropriately. There are other items in your wellness care kit. One is a Help Me Grow early intervention brochure to continue to promote the Help Me Grow program in your practice. This brochure also includes a helpful developmental checklist for caregivers. The green ribbon squishy and How's the Baby cell phone holder are for medical staff. How's the Baby reminds us that infants also have mental health, and it's important for us to share with caregivers that they should talk, smile, sing, and interact with their babies. The MHRB flyer is a resource for your staff. They can share the crisis line numbers with caregivers for multiple emergencies. The 211 United Way referral line is for help with a multitude of community services. The RX pad can be kept on your desk to remind you of relational health. It can also be left at the nurse's station for when they're having conversations with patients. It can be helpful when paired with the infographic of the 6 ways to build a better brain. It is a reminder that mental health is important as physical health. Thank you for your support of infant and early childhood mental health. Contact us to request more supplies, and also please take just a few minutes to fill out the quick survey on our website so that we can continue to partner with and support you as you do the very important work of keeping our community healthy. We truly appreciate all you do for our children and families.